So coming from ASH 2017, there's some new data now with how we can administer daratumumab. And historically, we've had some longer infusions of daratumumab, but now there's some updated data about using subcutaneous daratumumab, as well as now a 90-minute infusion protocol of daratumumab. And your thoughts about that and its clinical implications? Well,
I think the access to daratumumab really has changed the way we treat patients with myeloma, that's for sure. I think a key barrier for many doctors is the long infusion times. Patients sit for a very long time in the infusion chairs, and it's also very practically difficult if the infusion goes late in the evenings. It's inconvenient for the patient. So having a better way to give the drug, that's obvious. So the subcutaneous administration, I think, is going to be very, very important going forward. There is ongoing work on that. There's a randomized study, and the FDA has clearly stated to the company that you need to show non-inferiority data. For right now, it seems that it's the same safety and the same efficacy, but it's not yet done the study. So here at ASH, we heard from the Ohio State group that they had taken the regular daratumumab and done an accelerated infusion. So the first and the second dose, they gave the same way as the FDA label says. And then thereon from the third dose and later, they gave only 90 minutes. And that seems to be very safe and in their hands. That's how they have implemented it. And we're going to do the same at my institution, because if we can do it in 90 minutes, that's great.
I think saving chair time is great, and you can't argue with that. And I think if the sub-Q formulation cuts down the time further, that would be great. As Dr. Usmani had earlier last year presented a 90-minute infusion, this was now down to 10 minutes. So it's certainly we're moving in the right direction.
Yes, yeah, very exciting data, and we are very happy about that for practical reasons. Also, if you start several patients the same day on daratumumab, it comes the capacity of your infusion center. That's number one. It's more convenient for the patients, but I think what is also important is it really cuts down the infusion-related reactions. So less patients had really symptoms like shortness of breath or runny nose or cough. So it also seems to be better tolerated if you give that subcutaneous. Probably the pharmacokinetic changes. You have a slower increase of the concentration of the drug, and that might contribute to the better tolerability.
Yeah, I mean, I think it's if we can really shorten it, it makes it a lot easier for patients. And we'll be up before you will, because Craig's coming to join us in Emory. So we'll see who can do it first.
Excellent. So really exciting data. Just to comment again, that 90-minute infusion is not with cycle 1, day 1.
Right.
It's on cycle 1, day, the third dose. Correct?
It's on the third dose. It's 90 minutes from that dose and forward.
So really important practical implications as we go into the clinics and translating that. So I think it's an important new data for our practicing physicians. So